This is Dr. Mansi from Homeopathy 360. Welcome to you, all of you. And today I'm very happy to say that Dr. Shweta Singh is with us today on another day of Beyond Boundaries with Homeopathy 360 webinar series. So, Dr. Shweta Singh, ma'am, is a MD homeopathic physician, researcher, and educator. She is currently president at Delhi Homeopathic Medical Association. A very, very congratulations to you, ma'am.
Thank you so much.
She became the first female president of this association, which was founded in 1932 by Dr. Yaduvir Singh, first health minister. And she was also senior research fellow at Central Counseling for Research in Homeopathy headquarters, New Delhi. She is also senior consultant at Orbit Clinics. She brings with her a rich experience of more than 10 years and expertise in treating many difficult cases. She is graduated in BHMS from Baxon Homeopathic Medical Delhi NCR and completed her MD in homeopathy from Sri Guru Nanak Dev Homeopathic Medical College. She had also completed her PG in health promotion from National Institute of Health and Family Welfare, New Delhi. She is also Chief Administrator of KHA Homeopathy Study Group, USA. She was also Chief Editor at Hanimanian Homeopathic Sandesh and was also Chief Editor of biannual newsletter exploring homeopathy and initiative by Orbit Clinics. Dr. Shweta Singh ma'am has done a lot in this homeopathic field, and we are really very proud of her, and we are very inspired from you, ma'am. Today we are today with you as our respected speaker. Thank you so much, ma'am, for being with us. And this platform is today all yours. Please share your knowledge and your expertise.
Thank you so much, Dr. Mansi, for this beautiful introduction. And I'm really privileged and honored to got this opportunity to share my little knowledge with all of you. So thank you for this. Let me share my screen.
Yes, ma'am, sure.
Is it visible?
Yes, ma'am.
So
You can full screen this website. Yes, ma'am. Now it's perfect.
thank you. So today, my topic of discussion is evidence-based homeopathy in gynecological conditions with some few case illustrations. Females, as we all know, they are the strong pillars of our society, without whom we never come into existence. Uh, an emergence of a strong, healthy society requires a healthy woman. As a female, we undergo major physiological changes throughout our life, from birth to death, from menarche to menopause, during pregnancy, during puberty, during our menstrual cycles. So every milestone is, somehow have effect on our health. There are many negative life events which may cause disturbance in our hormonal uh, field, which affects our health and which can be a cause of many disease conditions. Definitely, with the risk factors, the sedentary lifestyle or our faulty dietary habits, or miasm, if we say in terms of homeopathy. So today we will going to discuss how to approach these disease conditions of female with homeopathy along with some case illustrations. As we all know, being a homeopath, we know that homeopathic case taking is different from the modern medicine. And in homeopathy, we treat the patient as a whole, not just the parts the organs or the systems, but we treat the patient as a whole, as one unit. And aim of homeopathic case taking is individualization, which means that we need to differ one every single case with same disease condition to another with some exclusive features. We need to individualize each case, because if we don't do that, no real cure will take place, because it need that strict particular treatment, that individualized treatment for each case of disease. We do case taking to individualize our case, but before that, aim of case taking is the pathological diagnosis, in which we note down the common symptoms which make diagnosis of a case. Then the other aim of homeopathic case taking is the therapeutic diagnosis. We need to find out those exclusive features that individualize a case and that will allow us to select the simillimum. So therapeutic diagnosis is very important in homeopathic case taking. Now, in aphorism 153, Dr. Henneman wrote that the more striking, singular, uncommon, peculiar, the characteristic symptoms of the case of disease are the chief and most solely to be kept in view, because these most striking, singular, uncommon characteristic symptoms are the only exclusive features which helps you to individualize your case. So these cases are important for prescription. They will guide you for the simillimum. And these features, common symptoms, you can get in every case. Common symptoms later, you cannot reach out to the simillimum. So you have to find out these exclusive features, these characteristic symptoms. Or if the case is, curable, you will definitely get these symptoms, these kind of symptoms in your case. But they are hidden in the minute details of your case, of the case taking. So you have to find out these symptoms. You have to require skills to find out these striking, uncommon, peculiar characteristic symptoms in your case. It can be hidden in the cause, it can be hidden in the location, in the modalities, or in the associated symptoms. You never know. So, a detailed case taking is the key with which you can find out you can reach out to your simillimum, which can be beneficial to your case and which can cure your case. Dr. Henneman in aphorism 94 footnote specifically defined what to be done, what to be asked in the cases of female, especially in the chronic diseases of females. So it is specifically necessary to pay attention to pregnancy, sterility, the sexual desires of females, accouchements, miscarriages, suckling, the lactation period, and the state of menstrual discharge. So, in every female case, you have to ask about these states. With respect to the last name, particularly, we should not neglect to ascertain if it recurs. यहाँ डॉक्टर हैनीमैन जो है वो मेंस्ट्रुअल डिस्चार्ज की बात कर रहे हैं कि मेंस्ट्रुअल डिस्चार्ज में भी वी हैव टू आस्क द फीमेल about the state of menses, if it recurs at too short interval or if it is delayed beyond the proper time, for how many days it lasts, whether the flow is continuous or intermittent flow, whether it what is its general quality. How dark is its color? What is the color of the flow? What is the quantity? If it is scanty, if it is profuse, if it is copious, you have to ask the patient about the character of flow. Then along with it, you have to ask about the white discharge or leukorrhea before its appearance or after its termination. सो मेंसेस से रिलेटेड जितनी भी इंफॉर्मेशन आप एक फीमेल से ले सकते हैं, जस्ट लीजिए, बिकॉज इट विल फॉर्म द टोटलिटी. देन मेंसेस से पहले कोई प्रॉब्लम फीमेल फेस कर रही है, प्री मेंस्ट्रुअल सिंड्रोम जैसे कि हम नाम देते हैं, सो उससे पहले क्या क्या उनको प्रॉब्लम्स हो रही हैं, दैट इज ऑल्सो इम्पॉर्टेंट. ड्यूरिंग मेंसेस फीमेल क्या सफर कर रही है, दैट इज इम्पॉर्टेंट. एंड आफ्टर मेंसेस क्या फीमेल को किसी तरह की कोई प्रॉब्लम हो रही है, दैट इज ऑल्सो इम्पॉर्टेंट. सो ऑल द 3 फेजेस को आपने देखना है, समझना है, पूछना है बेसिकली. मॉडर्न मेडिसिन में इस तरह से डिटेल्ड केस टेकिंग नहीं ली जाती, एंड होम्योपैथिक केस टेकिंग में यही डिफरेंस है जो कि डॉक्टर हेनीमैन ने अपने ऑर्गेन ऑफ मेडिसिन में स्पेसिफिकली हमें बताया भी है. देन आफ्टर दैट, इफ इट इज एसोसिएटेड बाय एनी बॉडीली और मेंटल एलिमेंट्स, बॉडीली यानी कोई फिजिकल एलिमेंट्स के साथ तो मेंसेस नहीं हो रहे हैं, लाइक डिस्मेनोरिया होता है, देन बैक एक, किस तरह का पेन है, यू हैव टू आस्क द फीमेल अबाउट all these things. What sensation, what pain, if it is preceded, accompanied, or followed. If there is leukorrhea, leukorrhea भी है तो what is its nature, the character of that vaginal discharge, वो कैसा है, if it is offensive, what kind of smell it has, what is its color, if it is yellow, white, thick, egg like, bluish in color, greenish in color, what color it has. Then if it is associated with any sensation, if it is associated with any pain, or if there is no physical complaints with that, it is a possibility that she has some mental symptoms with it: irritability, weeping, weeping, excessive anger. So you have to ask the patient about it, what sensation attends its flow, in what quantity it is, what are the conditions and occasions under which it occurs. So we have to find out those modalities. If it is better by sitting, if it is aggravated by lying down, if it is aggravated at night or in the daytime, ये सभी इस तरीके के symptoms हमारी मटीरिया मेडिका में हमें already it is written, but we have to ask the patient about it. So location is important, modalities are important, the associated complaints are very much important in the female case takings. Then the selection of the simillimum is basically dependent upon the totality of the symptoms. What is this totality? The total symptoms? No, we are not talking about the quantity of the symptoms. ऐसा नहीं है कि हमने बहुत सारे सिम्टम्स ले लिए तो वो एक टोटलिटी बना लेगी, नहीं. टोटलिटी ऑफ द सिम्टम्स, आप ऑर्गेनॉन पढ़ेंगे तो टोटलिटी ऑफ सिम्टम्स, इट इज नॉट रिटन टोटलिटी ऑफ सिम्टम्स. ऑर्गेनॉन में हर जगह टोटलिटी ऑफ द सिम्टम्स लिखा है. सो व्हेन वी आर गिविंग इंपॉर्टेंस टू दोज सिम्टम्स, जो सिम्टम्स इंपॉर्टेंट है, अ ग्रुप ऑफ सिम्टम्स which reflect the patient as a whole, ऐसे symptoms हमें वहां से चूज करने हैं. Those striking peculiar characteristic symptoms जो कि एक पेशेंट को की पूरी कंडीशन को रिफ्लेक्ट कर रहे हैं. उन इस टोटलिटी में, दिस इज द क्वालिटेटिव टोटलिटी. इस टोटालिटी में मेंटल सिम्टम्स भी हो सकते हैं, फिजिकल सिम्टम्स भी हो सकते हैं और पर्टिकुलर सिम्टम्स भी हो सकते हैं. So we have to make this totality. So I hope the case taking is clear. Now we will discuss cases and इसी में हम सीखेंगे कि हम किस तरह से ये केसेस जो हमारे पास जो कंडीशंस आ रही हैं हम किस तरह से उन्हें अप्रोच कर सकते हैं. So the first case is of endometrial polyp. The female patient of 27 years old, unmarried female with fair complexion, dark circles around the eyes. She approached me on 13th September 2020. Now, the presenting complaints were intermenstrual vaginal spotting since 5 to 6 days. And there is weakness with trembling of legs. Now, the patient came to me in 2020. एंड मैं ज़रूर ये डिस्क्राइब करना चाहूँगी कि पेशेंट जब मेरे पास आई तो शी वॉज लुकिंग वेरी डल, शी वॉज लुकिंग वेरी वीक और एक डिप्रेस्ड पेशेंट जैसा आप इमेजिन कर सकते हैं. शी वॉज लुकिंग लाइक दैट. 5-6 दिन से उसको इंटरमेंस्ट्रुअल वेजाइनल स्पॉटिंग हो रही थी. शी वॉज फीलिंग वेरी वीक कि जब वो मेरे पास आई तो जो उनके अटेंडेंट्स थे वो उनको पकड़ के मेरे पास लेकर आ रहे थे. शी वॉज अनेबल टू वॉक ऑन हर ओन. Then she started complaining of that intermenstrual spotting when she urinates. She looked very depressed, and on further inquiry, it was found that there were some family disputes which were going on in her family for the last 15 to 20 days. And after that scenario, she became very silent and very irritable. Anger is quite visible, but it was suppressed. She was not talking to her family members. Otherwise, she was a very sincere, happy girl. She was emotional. That was narrated by her attendant. Now, in the menstrual history, it was found that she had her menses on 29th August 2020 for 2 to 3 days. It was fine. And in the past history, there were acne. On examination, it was found that her BP, she was hypotensive and her BP was found to be 100 by 60 mmHg. Tongue was clean and moist. In the physical generals, as I told you, there were some family disputes going on. She was not talking to any of the family member. She was looking very depressed. So the appetite was very decreased, quite decreased, and she don't want to eat anything. She was thirstless. There were desire for salty things. She was a hot patient. In mental generals, she was irritable, but the anger was suppressed. She was jealous of her, one of her family member, and there was contradiction which aggravates. She became angry on slightest triggers but does not express herself. There was suppressed anger. She weeps only when alone. Consolation also aggravates her condition. She was fastidious. Then I asked her to get her ultrasound done. And in the ultrasound, as you see, it reveals that the endometrial lining was mildly thickened and heterogeneous in echo pattern, and there was an endometrial polyp with the size 11 into 7.8 mm. You can see the reports. Then on repertorization, as there was irritability, jealousy, the VP when alone, contradiction, aggravation, all her mental symptoms were pointing out to the top grade remedy, which was coming through repertorization, that is natramure. The patient was hot, she was hypotensive, there was that depressed, sad mood, irritability, suppressed anger, and I go with that top grade remedy and I prescribed natramure 200 to her. sorry, it was that AMN was not prescribed. Only natrium 200 was single dose was prescribed in that this case. Then on follow up, there was no menstrual bleeding. उसको किसी भी तरह की intermenstrual bleeding नहीं हुई इस बीच. Then the patient was physically and mentally, she was feeling better. Menses were profuse but last for 7 days. And there was an old symptom which recurred, that is the pustular eruptions appeared over genitals. It was her old symptom. So in that case, because she is mentally better, she was physically better, and there was no intermenstrual bleeding, so I prescribed rubrum med 30 BD for a month. After a month, in November, there was again no intermenstrual bleeding. But as there are winters, so she complained of cracked and chapped fingertips. There was hyperacidity with irritations, and she also complained of back pain with stiffness. So the symptoms, she is better. Bleeding, intermenstrual bleeding was not there, but there are complaints which are not uh, getting better. So I, after 3 months, I asked her to get one more ultrasound to be done. She was on SL for that period because she was mentally better, and there was no intermenstrual bleeding for that time. So after this, one ultrasound was done, and in the ultrasound, you can see the endometrial polyp, the size of the polyp got increased with natrium 200. Then, but the size from 11, it reaches to 13. But there is one positive sign, that the endometrial lining, which was heterogeneous in character in the first ultrasound, it got normal. There is no heterogeneity of the endometrial lining. So in this case, I prescribed natrium 1M to her. In the next follow-up, she was better. There was no episode of intermenstrual bleeding, but the patient was very much irritable towards her family. On further questioning, it was found that the patient was very much indifferent to her family members, especially to her mother, whom she loved the most. She stopped talking to her mother at that time. Though intermenstrual bleeding was not occurred, but backache was still same. I observed hyperpigmentation over her cheek area. She also complained of leukorrhea, that is white in character, thick and offensive. With all these symptoms, I prescribed her CPR1M single dose, followed by rubrum med 30 BD for another 1 month. Then she was fine with that treatment, and in the next ultrasound, it was seen that the scan was normal. There was no endometrial polyp after CPR1. CPR1M was also prescribed because of the totality which was given by the patient afterwards, and it is the one of the complementary remedy of natrium. So on the basis of that totality and that relation of the remedies, I have prescribed CPR, and it worked with a magically. So this is the first case in which we learned that एक मेडिसिन हम रेपर्टाइजेशन के बेसिस पे सिलेक्ट जरूर करते हैं, वर्क भी करती है मेडिसिन, बट समटाइम्स केस टेकिंग हर एक फॉलोअप पर करना और पेशेंट को और जानना, ऐसा जरूरी नहीं कि हम अपने पेशेंट को फर्स्ट सिटिंग पर ही जान जाए और हम फर्स्ट सिटिंग पर ही पेशेंट को उसका सिमिलम जो रिक्वायर्ड है वो प्रिस्क्राइब कर पाए. Sometimes it takes a number of follow-ups to reach out to that simillimum. And in that case, in this case स्पेशली जो रिलेशनशिप ऑफ रेमेडीज है वो मुझे काम आया. सो कभी कभी ऐसे होता है कि हम एक्यूट मेडिसिन या एक फेज जो खत्म होता है उसके बाद दैट पेशेंट may require some other medicine, and you may find that remedy in the relationship of remedies. So it is very important. Now the second case, it is a case of ovarian cyst. A whitish complexion lady, 39 years old, came to me with left sided ovarian cyst. The presenting complaints were pain in left iliac region, hypogastric region since 3 months, aggravation during menses, more pain when the flow starts. तो लेफ्ट साइडेड पेन था, लेफ्ट साइडेड ओवेरियन सिस्ट था. लोकेशन इज इंपॉर्टेंट, राइट? देन द मोडालिटीज, एग्रोवेशन ड्यूरिंग मेंसेस, और जैसे जैसे फ्लो बढ़ता था तो पेन भी इंक्रीज होता था. Then she also complains of early, profuse, prolonged menses since 2 to 3 months. A duration was 10 days. There was white discharge per vagina, thick, white, and little offensive. Associated complaints were constipation, bleeding per rectum since 1 year. Uh, on and off, bleeding was on and off for bright red in color, with pain during and after stool. Also, with this, she also complained of pain and heaviness in legs. There is a sense of fragility. Sense of fragility means कि पेन इतना ज्यादा था या सेंसिटिविटी पेशेंट की इतनी ज्यादा थी कि आप पैरों को हाथ भी नहीं लगा सकते. अगर आप हाथ लगाते हैं तो पेशेंट एकदम से चिल्ला जाता है कि मुझे बहुत पेन है, प्लीज डोंट टच. सो इतनी ज्यादा सेंसिटिविटी या फ्रेजिलिटी थी कि हाथ लगाओगे तो टूट जाएगा. There were muscle cramps or twitching, which was aggravated at night and touch. In physical journals, there is high desire for tea. She craves for tea 7 to 8 cups per day, though it causes flatulence, but फिर भी चाहिए. She cannot resist the craving. So the craving for tea was very much in this patient. Stool, she had constipation. There was history of piles, on and off bleeding. Sometimes the pain is that much in that intensity that the stool recedes back. Perspiration were more around the neck and the genitals. She was a chilly patient. In the mental journal, she was irritable on slightest trifles, anger towards her family members. She fights with her husband and mother-in-law on every little things. She was very quarrelsome and every contradiction aggravates. She also complains of dreams of falling. उसको एकदम से झटके लगते थे कि वो नीचे गिर गई. And also dreams of dead people. This was her ultrasound, which shows that there was a hemorrhagic cyst of 35 mm. Totality जो पेशेंट की बनी, that was left sided hemorrhagic cyst, ovarian cyst. Pain in the left ovary, left hypogastrium, left iliac region, sorry, during menses. जैसे जैसे पेन बढ़ता था वैसे वैसे फ्लो के साथ पेन बढ़ता था. पेन aggravates with the flow. Desire for tea, dreams of falling from the high places, dreams of dead people, sweat on the neck and genitalia, and there is brittleness of bones. Can you please write down the probable remedies which you can think of in this case? What should be given? I repertorize this case. And
Yes, ma'am. So some attendees have guessed the remedies.
okay,
Like Sai Harshita has said Thuja.
okay. Any more comments?
Any other comments?
So I repertorize this case: tumors, ovarian cyst, left-sided, pain, aggravation during menses, desire for tea, falling from high places, dreams of dead, sweat on throat, neck, and genitals, and brittleness. So yes, Thuja was given in this case, Thuja 200 single dose, followed by Rubramid 30 3 times a day for a month. And with this single remedy, after 3 months, we have got her scan USG, and there was no cyst there in the report with single dose of Thuja 200. This is the beauty of homeopathy कि जब हम सिमिलम देते हैं तो वहां पर रिजल्ट आपको सिंगल डोजेस से भी मिलते हैं. Why Thuja was given? Because it is the prime remedy which has its profound action upon the glands with stitching, tearing pain. The pains are as if glands were being torn to pieces. This is a left-sided remedy where the ovaries are much more affected than any other organ. The pain aggravates during the flow, coming on at the time of menstruation. In mental symptoms, there is irritability towards the family members. क्यों? क्योंकि जैसे बिकॉज जब वो लेडी आफ्टर मैरिज घर में आई तो उसने सब कुछ करने की कोशिश करी, बट द इन लॉज, द हस्बैंड वाज नॉट हैप्पी विद हर. तो वहां से कुछ भी अच्छा किया तो कोई क्रेडिट नहीं मिला. दे आर ऑलवेज ब्लेमिंग हर. तो वहां से वो इरिटेबिलिटी डेवलप हुई. नाउ शी इज वेरी इरिटेबल टुवर्ड्स देम. नाउ शी इज वेरी क्वेरलसम, बट शी इज स्वीट इन फ्रंट ऑफ द स्ट्रेंजर्स. वो आपके सामने या स्ट्रेंजर्स के सामने शो नहीं करेगी कि वो इस तरीके से रह रही है. She had that disposition to cheat. She wants to be alone. She has that emotional sensitiveness. Sensitiveness in every sphere, in the emotions, at the physical plane. कि हाथ मत लगाओ, टूट जाएगा. As if the limbs are made of glass. There is heaviness, right? Music causes weeping and trembling. When walking, the limbs feel as if made of wood. Sensation as if limbs were made of glass, would break easily. Perspiration on the uncovered parts. Sweetish in nature, smells like honey, sometimes like garlic, strong, pungent smell. Dr. Clark, one of the main thing, the desire for tea. Dr. Clark mentioned करते हैं, people are all vaccinated and drinks tea. He used to say Thuja is the greatest antidote to tea in vaccination. उसको problem हो रही है फिर भी चाय पीनी है. So there could be some, bad effects of that tea, which can be antidoted with the use of Thuja. So on the basis of this totality, Thuja was given and it acted miraculously in this case. Now this is one more case of Isthmocele. Isthmocele is basically a cesarean scar. After cesarean deliveries, इस तरह की कॉम्प्लिकेशंस हमें देखने को मिलती है. सो दिस इज lean thin female patient which reaches out to me on 7th November 2023. She's 29 years old. She complained of excruciating pain in her lower abdomen since 6 months, and which was aggravated by motion while sitting वो बैठ ही नहीं पा रही थी बिल्कुल. During menses, the pain was also aggravated. She's better by warm and by lying down. There was general weakness, which was also present. There was wide discharge, which got worse and persistent for the last 6 months, जब से उनको pain start हुआ. Then associated complaints were backache and burning soles, which aggravated in the evening. There was a history of cesarean delivery 3 years back. Menses were fine. There was no such complaint during in menses. In abdominal examination, it was found that there was tenderness in the hypogastric region. Examination is also very important. You know, those general examination, BP, pulse, it is very important. कभी कभी आपको वहां से भी क्लू मिलते हैं, राइट? तो एग्जामिनेशन के दौरान टेंडरनेस भी प्रेजेंट थी, जो बहुत ज्यादा थी. एंड जनरल एग्जामिनेशन में pulse rate was fine, but BP was low. She was hypotensive and the BP was 90/70. In physical generals, there was not much significant, but she had that fear of pain. She was very in a state of anguishness. The pain was very severe. She had that fear. The patient was chilly, thirst was not that too much. Now the totality is formed by the ailments from post-surgical operation, excruciating pain in her lower abdomen, pain aggravated while sitting. Because हमें इस केस में क्या मिला? Causation मिला, modalities मिली, and कुछ general symptoms मिले. उसका fear मिला, hypotension जो BP लो था वो मिला. तो those symptoms were considered and उसके basis पे जो totality बनाई and case was repertorized. तो repertorization करने के बाद जो remedies हमें मिली वो आपकी स्क्रीन पर है. नक्स वोमिका, carbolic acid, staph, carbovate, staph, lycopodium, colocynth, mark. So in this case, I selected staph, जो कि थर्ड नंबर पर आ रही है, बट इट इज द फर्स्ट ग्रेड रेमेडी फॉर द प्राइमरी कॉज. और प्राइमरी कॉज क्या था? दैट वाज द पोस्ट सर्जिकल जो ऑपरेशन था, उसके बाद उसको कंप्लेंट आई थी. So staph is a key remedy for after surgical operations with smarting and stinging pains. There was sensation as of a cut by a knife. It is a great remedy for incised wounds, clean cut wounds from surgical operations. And the modalities were also matching, like aggravation from sitting, amelioration from warmth. So on the basis of this, I prescribed her Staphysagiria 200. Pain के लिए I also gave her magnesium phos 6x. On a SOS basis, कि pain ज़्यादा हो तो please take these tablets. And you can see her ultrasound report. There was outpouching, a U-shaped focal outpouching at the site of prior cesarean section, which suggested of Isthmocele. Now, after Staphysagiria 200, on the next follow-up, leukorrhea तो थोड़ा decrease हुआ, but the pain was almost same. There was no difference in the intensity of pain. Then I stick to the remedy. मैंने Staphysagiria 1 ml single dose में दिया, followed by magnesium phosphoricum 6x. But on the next follow-up, pain was almost same. कोई difference नहीं आया patient में. Although हमने repertorize भी किया, हमने जो अपना बेस्ट कर सकते थे, we did that, but pain बिल्कुल भी relief नहीं हुआ. Blood pressure was also same because पेन ज्यादा था, ब्लड प्रेशर भी लो हो रहा था, वीकनेस वाज आल्सो प्रेजेंट, एंड जो बैक एक और बर्निंग सोल्स थे वो भी सेम ही इंटेंसिटी में थे. इन दिस केस बिकॉज पेन जो है वो सबसे ज्यादा हमें चीफ कंप्लेंट जो थी वो पेन हमें मिल रहा था, तो आई प्रिस्क्राइब्ड हाइपेरिकम 200 इन दिस केस. हाइपेरिकम क्यों? बिकॉज इट इज अ ग्रेट रेमेडी फॉर पेन after surgical operations. It is written in Boric. So on the basis of that clinical experience, मैंने इस केस में हाइपेरिकम दिया. आई थॉट कि किसी तरह पेन कम हो सो दैट हम आगे फिर ठीक है वी कैन मैनेज, बट सबसे पहले जो पेशेंट हमारे पास जिस चीफ कंप्लेंट्स के लिए आया है हमें वो रिलीव करना बहुत जरूरी है. बट इन दिस केस हाइपेरिकम के बाद जो पेशेंट की स्टेट थी वो और ज्यादा एक्टिवेट हो गई. इन द नेक्स्ट फॉलो अप द स्टेट ऑफ द पेशेंट एग्रोवेटेड. पेन जो है वो और इंटॉलरेबल हो गया पेशेंट को. पेशेंट वॉज अनेबल टू सिट इन एनी पोजिशन. Slightest touch aggravated her pain, and there was thick blooding mucoid discharge, which was noted by the patient during urination. Weakness, back pain, burning soles, सब कुछ it was same. Then on the basis of those pathological symptoms जो कि हमारे पास थे, जो totality हमने बनाई थी, उसके basis पे one more remedy came to my mind, that is strontium carb. On that pathological similarity, I prescribed strontium carb to this patient. See, initially हमने हमारी अप्रोच वही थी कि टोटालिटी बनाई, रिपर्टराइज किया, जो मेडिसिन हमें जो भी जो मोस्ट सिमिलर रेमेडी हमें लगी लाइक स्टाफ, हमने वो प्रिस्क्राइब किया, राइट. There was little the patient was little better with that staph 200. Leukorrhea was little better, so we stick to that remedy. हमने हाई पोटेंसी में भी दिया, लेकिन क्या हुआ? There was disease aggravation. Then in such cases जहां पे हमारे पास इतना टाइम नहीं होता कि हम डिटेल्ड केस टेकिंग, पेशेंट दर्द से करा रहा है एंड हम वहां डिटेल केस टेकिंग करने बैठ जाएं, तो इट शुड नॉट बी डन इन दैट केस. तो वहां पे समटाइम्स हमारी जो एक्यूट रेमेडीज हैं वो हमारे बहुत काम आती हैं. आई ट्राइड दैट, हाइपेरिकम दिया, बट वहां वो भी काम नहीं आई. और अभी भी हमारे पास टाइम नहीं है कि हम बहुत ज्यादा हम फिर से डिटेल केस टेकिंग करें, हम फिर से रेपर्टराइज करें और उसके अकॉर्डिंग हम ट्रीटमेंट दें. तो यहाँ पे हमारी क्लिनिकल नॉलेज होना, हमारी हमें जो पैथोलॉजिकल हमारी जो एक्यूट रेमेडीज हैं, जो कि हमारी छोटी छोटी मेडिसिन हैं जो कि बोरिक में मेंशन है, हमें उसकी नॉलेज होना भी बहुत जरूरी है. तो इन दिस केस वो पैथोलॉजिकल सिम्टम्स के बेसिस पे आई ट्राइड strontium carbonicum 30 ch in thrice a day. Why strontium? Because it is a remedy used for shock after surgical operations, useful for chronic sequelae of hemorrhages after operations with much oozing of blood with prostrations. It relieves the patient pains that make patient faint or sick all over. So इतनी intensity में pain होता है कि patient is which can make the patient faint or sick. Great remedy for neuritis, and the remedy also covered the modalities of the patient like amelioration from warm application and aggravation on motion. So I prescribed this medicine, and in the next follow-up, the patient to came to me with a smile on her face, and a sense of relief was quite visible. This time she had 70% relief in her pain. She can easily sit in squat position, which was not the case prior to this remedy. Weakness has improved remarkably. Blood pressure has improved. The backache was also better. Leukorrhea was also decreased. So she has about 70% relief with this remedy in the next follow-up. And after continuing this remedy for further 10 or 20 days, I asked her to go for ultrasound, and you can see there was no significant abnormality found in the ultrasound report. So हमें इस तरीके के केसेस भी अपनी क्लिनिकल प्रैक्टिस में देखने को मिलेंगे, जहां पर हम पूरी मेहनत कर लेंगे, रेपर्टराइज कर लेंगे, लेकिन मेडिसिन काम नहीं करेगी। वहां पे समटाइम्स हमारे पास मेडिसिन की, अपनी मटीरिया मेडिका की जो रेयर रेमेडीज हैं उनकी नॉलेज होना बहुत जरूरी है, विच कुड बी ऑफ हेल्प इन such scenarios. There's one more case of uterine fibroid. An obese female, 45 years of age, housewife, consulted me in 2023. She was diagnosed with uterine fibroid since 3 months. And in the report, you can see there was subserosal fibroid in the anterior myometrium with a size 25.2 into 19.2 mm. Presenting complaints were menorrhagia since 3 to 4 months. The character of flow was profuse, dark red with clots. She had her menses in 19th November 2023, and accompanying symptoms were back pain, and there is heaviness in both the breast, which aggravated before menses. In the past history, she had cervical spondylosis since many years, and with vertigo. She was anemic. The HB levels were 10.5 gram per day, and she was diabetic, taking allopathic treatment for the same. In the general symptoms, physical generals, the thirst was normal. She had desire for salty things, chicken, cold drinks, and tea. Intolerance to spicy food was there, which leads to burning. There was aversion to sweets. Stool was hard occasionally. She was a hot patient, and tongue was coated white in color. Mental generals, she was irritable with anger suppressed, which was suppressed, and there was weeping. On repertorization of the case, these are the remedies which came after repertorization. In this case, I selected natramure for this case. The other remedies which came are calcarea, phosphorus, and sulfur. This was the totality. Natramure was selected along with Auramure natronatum 3x, one tablet 3 times a day, which was followed Natramure 200 and given for 10 days. Why Natramure was selected? Because in calcarea, the patient was lazy. Though my patient was also chubby and flabby, but my patient was hot in thermals, while calcarea is chilly. My patient was not that much lazy, or she is very active. She don't have any aversion to work or exertion. Calcarea has a core feeling of insecurity, which was not there in my patient. The next remedy, phosphorus. The phosphorus is, very is a very extrovert personality. He likes to make friend, which was not the case with my patient. Phosphorus were very socialized होते हैं. They are very oversensitive to external impressions like noise. Though they desire cold, my patient also likes to have cold drinks. But phosphorus is also chilly patient. They are tall, lean, thin patient होते हैं. My patient was not. The personality of my patient was not like that. In sulfur, sulfur desires, basically they are dirty, filthy patient, aversion to bathing. This is not the case with my patient. There was no such burning or that offensiveness which is associated with any of the complaint of my patient. There was not that dryness of skin or hair. There is no desire for sweets, though there was aversion to sweets in my case. So I selected Natramur because it covers the totality of my patient, that irritability, that suppressed anger, that thermals. My patient was anemic, which was covered by Natramur. There was desire for salt, and the patient was also hypertensive. The BP was low in my patient, and the personality was pointing towards Natramur. So I gave Natramur in this case 200, followed by AMN 3x. In the next follow-up, the flow was the menses were on time. The flow was reduced. It was not that profuse like before. The heaviness in breast was much better. Back pain was relieved. Irritability reduced. So in general, the patient improved with that medicine. So I prescribed Rubromet 200 single dose, followed by Aurum Netronetum 3x, one tablet 3 times a day. This is her ultrasound, and you can see in the 3 months, like I prescribed Natramur 200. This was her first ultrasound with subserosal fibroid of size 25.2 into 19.2 mm. Natramur 200 के बाद after 3 months we followed up the case with Auramur Natronatum 3x, one tablet 3 times a day, and after 3 months we got her ultrasound and it was all clear. There was no fibroid in the USG, and you can listen to the patient. मुझको थोड़े दिन पहले पीरियड की शिकायत हो गई थी, जिसके कारण मुझे 2 महीने आया नहीं। उसके बाद एकदम शायद मुझे 1 महीना तक लगातार पीरियड आता रहा, जिसके कारण फिर मैंने डॉक्टर जी को दिखाया, गायनो को दिखाया, तो उन्होंने मुझे बोला कि आप एक अल्ट्रासाउंड कराइए। तो अल्ट्रासाउंड जब मैंने कराया तो उसमें मुझको रसोली की शिकायत बताई। तो उसके थोड़े दिन बाद उन्होंने बोला कि अब आपको ऑपरेशन कराना पड़ेगा, जिसके कारण मैं थोड़ा डर गई थी। फिर मैं थोड़ा रुक के मैं थोड़ा इधर-उधर पूछी लोगों से, तो किसी ने मेरा एक रिलेटिव था, उन्होंने मुझे डॉक्टर श्वेता के बारे में बताया कि होम्योपैथी की बहुत अच्छी डॉक्टर है, अगर आप उनसे कंसल्ट करोगे तो वो आपको अच्छा इलाज बताएंगी। तब मैं उनके पास गई, तो उन्होंने मुझे दवाई वगैरह दी। अच्छे से 3 महीने के बाद फिर उन्होंने मेरा एक और फिर अल्ट्रासाउंड कराया, जिसमें मेरा रसोली की शिकायत बिल्कुल भी नहीं थी और मुझे बहुत अच्छा रिलीफ मिला, जिससे मैं आराम से मेरा ठीक हो गया। मैं बहुत अच्छा फील हुआ मुझे, मतलब कष्ट नहीं हुआ मुझे। So, do we have more time, Dr. Mansi?
Yes, ma'am. We have time to discuss if any attendee want to ask any questions. We
Okay.
can discuss now.
Yes, sure. So, thank you so much. This is all from my side. Thank you.
So, ma'am, we have one query, like from Akansha Dubey. She asked, "Why, ma'am, why not Nux vomica when it come up on repertorization when staff failed?" Miss Akansha, can you tell from which case you are asking?
I think she is asking for the Isthmocele case.
Yes, ma'am.
Right. So, Nux vomica was not thought of because the similarity symptoms are not similar to that. The patient was very mild. She had that fear. बिल्कुल चुप रहने वाली patient. She was not like Nux vomica, not that dominance was there, not uh, not that irritable patient. She was very mild. So I don't think of Nux in that case.
Yes, absolutely, ma'am. We have to also check for the personality of the patient. We
Definitely.
have to see the constitution of the patient. Okay, ma'am. Next, Dr. Namrata Patkar has asked why that 6x tablet like Automune Lunatricum. Please guide us.
I have given 3x in that case, uterine fibroid. And Auramure natum, basically, it is a prime remedy to dissolve those kind of fibroids or lumps. So I prescribed, this is, specific remedy or specific organ remedy for the uterine fibroids. So I prescribed that AMN 3X in that case. But the constitutional remedy always works. It is, I don't think it is just AMN, because I have been practicing since more than 10 years, and सिर्फ AMN देकर cases ठीक हो जाए ऐसा, I literally failed in starting of my career, जहाँ पे सिर्फ AMN से काम नहीं हुआ. So we have to think about those constitutional remedies, because वहाँ पे वो बहुत जरूरी है.
Yes, ma'am, surely. Any other questions?
Okay, ma'am. I think that's all the questions. And I would like to thank you for giving us your precious time. The session was really very informative, ma'am, and the cases you have discussed and shared were really very informative, and we learned today that.
Thank you.
And ma'am, today's time, we know the importance of these cases. Like as we can see, these cases are increasing in the females, and we really need to understand how to take a proper case, and how to process with all the repertorization and all. So you guide us today very well, and we thank you for sharing your experiences with the cases and all the diagnose guidance. Thank you so much, ma'am.
Thank you. Thank you so much.
And I would like to ask all the attendees if you have any reviews or suggestions you want to ask, and if you want to share your experience in the session, please share with us. And you can also watch the session recording on YouTube Homeopathy 360 channel. And if you have any other questions, you can also ask in the comment section. So, ma'am, some attendees are asking for, is there any book for gynecology with homeopathic treatment?
नो, बिकॉज देखो, मुझे लगता है कि जितना आप सीख सकते हैं, जितना पढ़ सकते हैं, कोई बुक खराब नहीं होती. एवरी
Yeah.
बुक इज प्रेशियस. तो आपको जितना पढ़ने को मिले, प्लीज रीड इट. एंड जितना आप वेबिनार्स के थ्रू, सेमिनार्स के थ्रू जो नॉलेज पा सकते हैं, बिकॉज अगर एक सेमिनार या एक वेबिनार से आपने एक टिप भी सीखी, सो दैट कुड बी बेनिफिशियल फॉर योर प्रैक्टिस. तो बाकी तो हम लोग खुद की ही गलतियों से सीखते हैं. जो इस्थमोसील वाला केस है, कहीं ना कहीं कुछ गलती रही होगी, तो हमारी जो सबसे बड़ा जो हमें सिखाता है वो हमारी खुद की गलतियां होती हैं, और हमें अपने एक्सपीरियंसेस के थ्रू ही सीखते हैं. सो नेवर गो फॉर शॉर्टकट्स. हमेशा हमें स्पेसिफिक रेमेडीज हम पूछते रहते हैं कि इसके लिए क्या, उसके लिए क्या. सो दे नेवर वर्क, राइट. कभी किसी केसेस में डेफिनेटली कहीं काम कर जाती होंगी, बट बेसिकली जो टोटालिटी पर जो आप मेडिसिन देते हैं, दैट विल डेफिनेटली हेल्प यू. तो आप कभी नहीं फंसोगे अगर आप एक टोटालिटी के बेसिस पे डॉक्टर हेनीमैन के मेथड से अगर आप प्रैक्टिस करते हैं, तो आप कहीं नहीं फंसोगे. डेफिनेटली यू विल, जीत आपकी ही होगी. सो वर्क लाइक दैट, एंड ऑल द बेस्ट टू ऑल ऑफ यू.
Thank you so much, ma'am. Okay, ma'am, we can wrap up this session right now. Thank you so much for your time.
Thank you. Bye bye. Good night.
Good night.